everyone. I'm delighted to be here today. I will be talking about ageism and COVID-19 with an attempt to talk not only about the present, but also about potential lessons for the future. Ageism is defined by the World Health Organization as a consistent bias which takes place in the way we think, feel, and act towards people because of their age. It's manifested as stereotypes, prejudice, and discrimination, which can be directed towards both young and old people and can be both positive or negative. In this present discussion, I will be talking about the negative implications and negative manifestations of ageism towards older people. And this is because this is really an ageist virus. We know that older people are more susceptible to COVID-19 negative consequences, including increased mortality and more severe illness. This fact actually has been instigating a general movement of ageism public discourse as well as in policy discourse worldwide. Older adults have been portrayed as weak, as vulnerable as a result of this same fact, and they have been homogenized as a single group that is affected by the virus, but also is going to cramp up the hospital beds and the vent machines in the future. This is why older adults have been portrayed as a burden to society, as a burden to the healthcare system that is already collapsing. This presentation of older adults as particularly vulnerable and younger people as being forced to socially isolate simply in order to protect older people has resulted in generations pitting against each other. There also has been a disregard to the instructions given by some segments of the population, thinking that this is not their disease. This disease has no implications for them. It only affects older people. At the same time, there has been a general disregard in public, among scientists as well, to the impact of the pandemic on younger populations, who might not be medically affected as much by the pandemic, yet some young people are going to be medically affected by the pandemic, just like some older people will not be affected. And at the same time, there is enough research now to show that younger people, more so than older people, are reporting higher levels of loneliness and reporting higher levels of worry, and also are more financially harmed by the virus and the entire measures that have been taken place in order to protect people from the virus. And we as a society have disregarded that because we've been very focused on older people. I think that two theories are particularly relevant when we try to think of this manifestation and increased ageism during the COVID-19 pandemic. The first theory is the terror management theory, which talks about the fact that we are really horrified to think of our own mortality, our own imminent death. And we try to do everything we can in order to move death and vulnerability away from us. The COVID-19 pandemic reminds us of our own death, of the potential death of our loved ones. It really shows us that life can be quite dangerous, and this might be one reason why ageism has been increasing, because we're trying to shed away from these constant reminders of our own vulnerability. The second theory talks about competition over scarce resources and the inherent assumption in each and every one of us that older people should not consume too much and should move away and give the leeway to younger generations. So if we don't have enough vent machines, it's going to be older people who will have to move away in order not to cramp up the hospital beds and the vent machine, and give the priority to the younger generations. So these are two theories, and now I will be talking a little bit about how ageism has been manifesting in real life. And two studies that have looked at ageism over Twitter have found that 11% of all the communication related to COVID-19 and older adults has talked about the fact that the life of older adults is less valuable than the life of younger people. About 5% talked about the fact that older adults should be isolated from society. And the term baby boomer remover has been particularly popular during the COVID-19, and this refers to the baby boomers and how the coronavirus is really removing them away from society. About 25% or 20% of all communication around Twitter related to COVID-19 and older adults has been classified as ageist in nature. So we see here how strongly the manifestation of ageism can be seen in the general public. It's interesting to note that the peak of the communication that has been ageist around older people has been on March 11th. And this is the exact date where the WHO has announced the coronavirus as a pandemic. If we look at the Weibo dataset, not at Twitter, but the Weibo, which is the Chinese equivalent of Twitter, we see that the communication is quite different. Actually, the most common theme was that of older adults as contributing to the community, and then older patients in hospital. Moreover, over time, there has been more comments like older people as caring for the young, and older people as being cared for as care recipients. So this really shows, I think, the cross-cultural variability, even though all in all, we would say that in many countries we have seen a surge in ageism. In other countries, this has not been the case. In addition to the discourse and the homogenization of older people as particularly vulnerable in contrast to younger people, we also see concrete measures that have been quite ageist, and these measures are manifested in lockdown strategies, in exit strategies, in triage, and in long-term care, and I will give some examples for each. In lockdown, we saw in the United Kingdom, where the initial talk was about older people over the age of 70 who should be initially instructed to socially isolate, and the rest of society was expected to go on and do whatever it has been doing all along. And just a particular segment of society, those 70 and over, were instructed to move aside. This did not happen in the end, but it definitely was an initial thinking that has led the government. In Bosnia-Herzegovina, we saw that older adults and also younger children were not allowed to leave their homes for several weeks. And in Serbia, Ireland, Sweden, and other countries, we also saw lockdown strategy that was specifically targeting certain segments of the population based on their chronological age. This is certainly an ageist practice. In terms of exit strategy, we saw that in countries such as Israel, where initially workers over the age of 67 were instructed to stay home. This did not take place in the end, but even the idea of telling older people that they should not go back to work and that the rest of society can go on its own and wouldn't mind the fact that a particular portion of the society is missing is a very ageist message that is going to resonate with people later on. Same in Canada, many EU countries, in Dubai, Abu Dhabi, we have seen the same thing where chronological age is used to tell people to stay home or to go out. In terms of triage strategies, we also saw very ageist practices. And basically, the idea is that when the system is overwhelmed, we have to find some strategy in order to balance the type of care that people receive. The general notion, and what WHO has been advocating for, is that those who are at the greatest need will have medical priority. This has not been the case in many countries. In Italy, there has been an age limit in the case of a system that is about to collapse, and we've seen that in real life. In Switzerland, even though they said that chronological age should not stand as a criterion, age did serve as an explicit factor in the discontinuation of treatment and in ICU admittance. So all these practices are very ageist because they're using chronological age to allocate services or to prevent people from participating in society. The long-term care settings are really, I think, the weakest link here. This is where most of the death due to COVID-19 have been taking place. In some countries, 80% of all deaths were attributed to older people in long-term care. In other countries, it was more like 40 or 50%. And the idea is that these people are more susceptible to COVID-19 because of the fact that they are older and because they have multiple comorbidities, but also they live in a residential setting that makes them more susceptible, very few opportunities to socially isolate or to physically isolate. And there is also the need to rely on caregivers who are moving from one room to the other and potentially spreading the condition. We know that in many countries worldwide, residents have been locked for months in long-term care settings, not seeing their family members, not receiving the medical care that they need. In some countries, such as Spain, we have heard about some residents who were abandoned as their care workers were fleeing away in order not to catch COVID. In other countries, in the US, we've heard about bodies of older people who were hidden for days during the pandemic. And in many, many, many countries, there's been limited workforce and limited access to person protective equipment that also exposed all the people in long-term care to the COVID-19 pandemic. These are all examples of ageism. And here we see how both the government and sometimes the institutions have been disregarding people's autonomy and have been disregarding people's lives simply because of the fact that they are older and now live in an institutional setting. I wanted to present one study to give you a better taste of what's going on with people in these type of long-term care settings. And this is a study that I conducted with my colleague in continuing care retirement communities. And these are actually settings where older people go to when they are independent, at least upon entering. Nonetheless, we know that older people have been confined to the units for months in this setting during the pandemic. So these settings that supposedly encourage autonomy and independence have turned into the Goffman total institution style. What we found was that older people in these settings reported a rupture between the way life was before and after COVID. And they tried to use downward comparisons, talking about other people, for instance, in the community, as being in a worse case to themselves in order to boost their own self-image and well-being. And they were saying something like, we are in a cage, but at least we're in a cage of gold here in this long-term care setting, in this CCRC. And this is compared to the community, where people don't even have this golden cage. Nonetheless, they were very explicit about the fact that staff have all the power during this pandemic-like mode. And this is a quote from one of the residents who said that initially no one spoke about the effects of the outbreak in the CCRC. So this was really a secret. And the only way that for this person to learn about this secret was by the fact that staff meetings were taking place under her balcony. So she was able to hear that. So it really shows a power imbalance, even in the amount of knowledge that residents had compared to staff. Another important factor that residents mentioned was the fact that past and present trauma really were living hand in hand, and people were talking about the fact that they have become prisoners of their own age. And those who were exposed to the Nazi regime in their youth or as children had a very hard time differentiating between their current experiences of the pandemic and their past experiences as Holocaust survivors. To conclude and to summarize these findings about the CCRCs, I would say that they were quite successful, at least in Israel, where this study took place, in physically protecting older people. However, this was done at the price of compromising other people's well-being. CCRC residents' defense mechanisms were successfully, to some extent, they were successfully protecting them to some extent. But as time went by and the rest of the country returned back to a new routine, these mechanisms had collapsed and other residents experienced high levels of stress, anxiety, depression, despair, and anger. If I summarize everything and try to give some recommendations with regard to the CCRC settings, I would say that management and staff really play a major role in the life of these residents. And this should be used for improving their quality of life rather than making them worse. More flexibility in those settings where we found some flexibility, where older people were in small capsules of several people interacting with each other during the lockdown. This has been extremely helpful. At the same time, we also have to remember that it's absolutely necessary to maintain people's physical and emotional routines. It's not enough to protect them from the coronavirus. We have to protect their mental well-being and physical functioning. And we know how detrimental it is, especially for older people who are already vulnerable, not to be physically active, not to be cognitively active, not to be emotionally active. It's also important to be very transparent about the measures that are taken and what's going on in the particular setting. So a collaborative approach is really necessary. This is another study that I thought would be interesting that looked at nursing homes in the US newspaper articles. And what the analysis found was that resident voices is usually excluded. And there is really no apology about that. It's almost a given that instead of giving residents a voice and hearing their own experiences, we hear the experiences of their family members. Another finding was that most of the communication around nursing homes in the media was about, was using elements of shock, of danger, deception. They tried to alarm us, which is good to some extent, but there was very little attempt to really approach this situation with a cognitive manner. It was more of the emotional manner, and a lot of blame gaming, especially around political issues. So if it was a right-wing newspaper, they tried to blame the institute. If it was a left-wing newspaper, they might have tried to blame the federal government. So it really shows how, instead of trying to approach the situation cognitively by trying to find a solution, by trying to identify the problem, there was more of the emotional game around it and a way to attract attention, but not to generate action necessarily. Basically, the study really suggests that there is a cultural model of panic and dishonesty that takes place around COVID-19 pandemic at nursing homes. The portrayal of residential cares as lacking transparency is going to create a future mistrust of the industry. And this is, of course, problematic because nursing homes do have a reason. They're here for a reason, yet things have not been going the way they should have during the pandemic. The depiction of the vulnerability of the residents is also problematic because it really does not allow any autonomy and any voice to those residents. To summarize the entire presentation, I would say that it is important to change the discourse. We still have to inform people about risk factors, and age is certainly a risk factor to the coronavirus, but we also have to mention and remind people that we are all in this together, and that susceptibility does not equal vulnerability. There are multiple incidents of intergenerational solidarity that should be encouraged, should be acknowledged. Maybe I have not talked about that enough, but it's certainly there, and we should remember that it's there and give it place. We also have to remember that the pandemic is not a reason for human rights violations. And this has been, I would say that the rights of all of us have been violated, but the ones who are older, the ones who are in institutions, have really experienced the most violations, and this has to stop. And finally, I would say that we should definitely not throw away the baby with the water. So although nursing homes have really turned into total institutions, and so did the continuing care retirement communities, still I think we should not throw away the baby with the water, and the concept of institutional care is still needed, but it definitely has to be addressed differently during the pandemic and also during normal times. I'm going to conclude now with the WHO campaign to combat ageism. The campaign started in 2016 and will continue until 2030. The vision of the campaign is a word for all ages, and the goals are to change the way we feel, think, and act towards age and aging. I would say that especially now, during the COVID-19 pandemic, this vision and these goals are particularly important for us to follow. And I'm optimistic. Even though we have seen a surge in ageism, I'm optimistic that things are likely to change as a result of the peak that we have seen. And hopefully now we are really at the moment of creating a societal change to live in a place where age is really not a burden and not a reason for violating people's rights. Thank you very much.